Nashville General Hospital opened in April 1890 as the city's first full-fledged community hospital. And for more than a century, our mission has remained unchanged: to provide real, honest healthcare for all. From internal and family medicine to dedicated women's health programs and life-saving emergency services, Nashville General Hospital is here to make sure your health needs are met. Patients look to our Dr. Robert E. Hardy Cancer Center, the GI Center, and our Heart Center for the best in chronic illness and specialty care. But we're here for the common cold or an annual checkup too. Our Nashville healthcare centers provide convenient clinic access to primary care physicians and specialists so that outstanding care is always just around the corner. Midtown to Madison, Bordeaux to Bellevue, downtown to Antioch, residents all around the city find the care they need at Nashville General Hospital. And part of what makes Nashville so special is the way we show up for one another. That's why we started the Nashville General Hospital Foundation. We connect those who need a boost with those who can provide a lift. Donor contributions make it possible for us to provide patients with both fresh and long-lasting foods through the food pharmacy program, host health fairs, provide warm clothing to those without it, and so much more. Everyone's a neighbor at Nashville General Hospital.
NGH offers annual mammogram screenings for patients to detect breast cancer in the early stage. Our radiologists provide diagnostic mammograms, breast biopsies, and breast ultrasounds to diagnose breast cancer. If treatment is needed, the oncology specialist at Nashville General's Robert E. Hardy Cancer Center can provide comprehensive breast cancer care. Nashville General Hospital's Breast Health Center offers both preventative care and treatment in the same inviting and comfortable setting. Patients experience a comprehensive and compassionate approach to the diagnosis and treatment of breast disease. Our wide range of clinical expertise includes full accreditation by the American College of Radiology and Mammography Quality Standards Act, MQSA. Staffed by fellowship-trained physicians, the Breast Health Center provides mammography, ultrasound, and stereotactic breast biopsy and surgeries as needed for treatment. Inpatient chemotherapy is administered on the 5th, 6th, and 7th floor medical surgical units of the hospital. Registered nurses providing the service are trained in the administration and handling of chemotherapy. The Dr. Robert E. Hardy Cancer Center provides quality care for patients with cancer, hematologic disorders, sickle cell disease, neurologic disorders, or renal failure. Nashville General's Cancer Center is supervised by a physician with Advanced Oncology Certification and staffed by experienced nurses certified in cancer chemotherapy. All patients receiving active treatment are followed closely for the duration of their therapy and after completion to gauge their response and whether they'll receive additional therapy. Nashville General Hospital's Infusion Center offers easy outpatient access to high-quality infusion and chemotherapy services. Staffed by registered nurses who specialize in intravenous and injectable therapies, Nashville General provides personalized, compassionate, and comfortable care to every patient we see. Clinical oncology research at Nashville General Hospital and Meharry Medical College aims to provide patient-centered, clinically meaningful access to experimental cancer and supportive care diagnostic and treatment options. Nashville General Hospital and Meharry Medical College research operations and staffing are primarily supported through U54 grant funding in collaboration with Vanderbilt University and Tennessee State University. Vanderbilt is also a sponsoring entity for Nashville General and Meharry Medical College's participation in SWOG, ECOG, and NHI-NCI trials. In 2020, the U54 structure broadened its focus beyond clinical trial to include a population focus. It emphasizes trials that promote equity in cancer screening, molecular and genetic diagnostics, counseling, and clinical trials amongst historically disenfranchised populations, i.e., low socioeconomic status, minority, public, under, or non-insured. Trials are selected with additional quarterly input from the Meharry Vanderbilt TSU Cancer Partnership Community Advisory Board, CAB, to ensure they are in the best interest of our patient population. All trial protocols are submitted through the Meharry IRB for legal and ethical approval and receive additional approval through the Nashville General Hospital Research Oversight Committee to ensure trials comply with hospital patient care policies. The Nashville General Hospital and Meharry Medical College Oncology Clinic research team meets weekly to review patients in studies and ensure trials are conducted without deviation from protocols. Laboratory tests at Nashville General Hospital are used in cancer medicine in multiple ways, including to help diagnose cancer with blood tests and tissue biopsies, to screen for cancer or precancerous conditions before the patient has symptoms of disease, for tissue biopsies, which provide information about the severity or stage of a cancer, for malignant tumors to establish the reach or size and/or extent of the original tumor and whether or not the tumor has metastasized to other parts of the body, to plan treatment, to determine whether a cancer is responding to treatment, and to determine if a cancer has reoccurred. The food pharmacy serves two audiences, providing food as medicine for Nashville General patients with certain diagnoses, including cancer, and healthy, no-cost food totes for individuals with food insecurities. The goal of the food pharmacy is to support chronically ill and cancer patients with resources that lead towards disease self-management. The hospital pharmacy compounds all chemotherapy and biologic agents administered in the inpatient units and outpatient infusion service. The community pharmacy at NGH is open to all patients, visitors, and staff of Nashville General Hospital. We strive to be the pharmacy of choice for patients and their families. Conveniently located on the first floor by the internal medicine clinic, the community pharmacy works with customers to get the best pricing for medications. As a convenience, over-the-counter items are also available at the community pharmacy.
I was originally diagnosed on January 22nd with stage 4 cancer, melanoma that had metastasized from my back and spread to 10 other parts of my body. It's been quite a journey. I'm actually a living miracle because in the beginning, the first doctor gave me 6 to 9 months without any good treatment. At first, that day when I found out, I obviously had a very emotional moment for about an hour. Talked to my family, cried a lot, got mad a lot, and I actually had a hockey game that night. I contacted my team, and I didn't know they were going to do this, but they rallied a bunch of my hockey community friends, and at the game that night, I had a cheering section of my own. They brought signs and everything, and it was kind of hard at first, but I scored a goal, and when I scored that first goal, I skated back to the bench, sat down, kind of buried my face inside my jersey, and I just let it all out, and decided I'm not going to let this beat me. I'm not going to curl up in a corner and wait to die. I'm going to keep living. I actually look forward to coming for my treatments, which a lot of people would think that's insane. They make me feel so comfortable. The nursing staff back in the infusion center themselves, all of them, they're great. I consider all of them my friends, the whole staff. I bought them roses one time, brought them in, and just to show my appreciation. One of the nurses back there, Stephanie, her husband plays hockey, and I actually brought them a hockey jersey that was very dear to me. It actually says Hockey Doctors on it, and it's got a red cross. I signed it with a thank you on it and gave that to them. I just try to give back for what they've all done for me.
Rooted near downtown Nashville for over 130 years, our campus and our services continue to be the heartbeat of the city. We stand as Nashville's partner on the path to long-term wellness because when individuals get and stay healthy, the entire city thrives. Nashville General Hospital is committed to serving all our neighbors everywhere. We're here for Nashville, and we're here for good.